according to the American Heart Association, a healthy diet and lifestyle are the best weapons to fight cardiovascular disease.
Our guest on this week's Health Talk, a nutrition expert, will discuss how your diet can benefit your mood, your health, and your heart.
So stay tuned. Andrea and I are up next.
Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Neeser. Our guest today is someone with important advice to help us live healthy lives. Barbara Schmidt is a frequent guest on Health Talk, and she is the Nutrition Lifestyle Program Specialist at Norwalk Hospital. And
Welcome
my personal
back.
on-time counselor as to how to keep trying to lose weight.
Thank you.
And Barbara, you're very active in cardiac rehab as well, so you have a lot of experience helping patients with heart disease.
Yes, I work at the hospital in cardiac rehab, and I do a class called Heart Smart there, so as well as seeing the patients individually. So
tell us, what are the goals of a Heart Smart diet?
So the Heart Smart diet is not just for the cardiac rehab patient, but the Heart Smart diet is for every person, young and old, on the face of the planet. We all want...
That's what I was hoping you would say.
We all want to practice a heart-healthy diet, okay? So primarily what we want to look at is the fats in our diet, because it used to be that we would tell people, people used to think that cholesterol elevated your cholesterol. We now know
Dietary cholesterol.
Dietary cholesterol would elevate the cholesterol in your diet, in your body. And let me just go back. One thing that people don't understand is that we need cholesterol. We can't live without cholesterol. And you make cholesterol in your liver, and therefore your blood cholesterol is a reflection of what your liver is making, as well as your lifestyle and what you're taking in your diet. And so we do know now that it's not just the total cholesterol. We've got the total cholesterol, but we've got our good cholesterol and our bad cholesterol, as well as our triglycerides that play a part in our heart-healthy diet.
And we're finding out more and more about particular kinds of cholesterol and lipids that may be important in cardiovascular disease.
So the bad cholesterol is the LDL cholesterol, and I always say it's the lousy cholesterol. What that does is that clogs your arteries, because cholesterol is like a waxy substance. I always say it's like liquid wax, like I show my patients a candle, and it sticks to the inside of your artery wall. So the LDL clogs your artery, while the HDL, or the healthy or the happy cholesterol as I call it, actually I call it nature's rotor-rooter. That takes any unused cholesterol and brings it back to your liver so it can be excreted. So we want more of that good cholesterol and less of the bad.
And actually, we've also learned increasingly recently that the lower your bad cholesterol, the better. It's not just a certain level, the lower the better.
Oh, absolutely, absolutely. And the higher the good, the better. And there is no drug that can elevate your HDL. They have not, or the good cholesterol. They haven't invented it yet. The only drug, and I always say, is exercise is your medicine. Exercise raises the good cholesterol. The foods that we eat will elevate that bad cholesterol. So those saturated fats, the fats that are solid at room temperature, so will raise the bad cholesterol. That's why we want to stay away from them. It's the fat on the steak that you don't want to eat. It's the skin on a piece of chicken that you don't eat.
You're listing all the really good stuff.
So it's the fat that's in whole milk that you use to make whipped cream, cream cheese. It's butter. So any fat that is solid at room temperature is going to raise the bad cholesterol. That's going to clog your arteries. We used to think it was the cholesterol, so people would ward off eggs because the yolk is high in cholesterol. But the yolk is also high in so many other nutrients as well, and we now know it is not the cholesterol that we're eating that raises your cholesterol level. It's the saturated fats. So we want to avoid, as much as possible, those fats that are solid at room temperature.
How about calories? Isn't it also true that lower calorie diets help to keep your cholesterol down in general?
Well,
I know because they go together.
You need to lose weight. So if you many times, the more fat that you have on your body, the heavier you are. If you're at an ideal body weight, your cholesterol is more likely to be within a healthy range. So I just want to get back to the fats. There's also a fat that gets a lot of press, and that's called trans fats. And many times people know that trans fats, oh, we don't want to eat trans fats, they're bad, but they don't know why. Trans fats are those hydrogenated oils. So they take perfectly harmless vegetable oil like corn oil and safflower oil and soybean oil. These are fine. These are polyunsaturated fats. They're fine. But what they do is they make them hard. They hydrogenate them. And they invented shortening, or stick margarine is a trans fat, or a can of Crisco, which I'm not supposed to say, I always say that's a heart attack in a can, because what these trans fats do is that they raise the bad cholesterol the same way naturally occurring saturated fats, but then they give you a double whammy and they lower your good cholesterol. So, and a lot of our fast food restaurants use these saturated fats to make the chicken nice and crispy, or the French fries nice and crispy. Now that has been outlawed in certain areas, in particular the New York metropolitan area. They're not allowed to use that anymore. But if you go to other parts of the country, they're using that shortening to like fry the donuts, to fry the chicken in, to fry the French fries in. And you need to read your labels for hydrogenated
That's exactly
fat.
what I was going to say. So knowledge is power, and
Knowledge
learning how
is
to
power.
read labels can
And
help a
so
lot.
they can say on the label, no trans fats, if per serving it's less than 0.5 grams. So you need to look at your crackers, because your crackers are crispy and flaky. And if my crackers were made with butter, they'd be crispy and flaky, but butter doesn't have a long shelf life. So they'll use these trans fats, and the trans fats, you have to look at what the serving size is. So if the serving size has 2 crackers and you're going to eat a whole sleeve of crackers, then you're getting those trans fats. Do you follow? If it says no trans fats on the label. So if per serving, you must look at that. Also, coconut oil is a saturated fat. Palm oil is a saturated fat, and food manufacturers use those in their cookies and crackers to make them crispy and flaky. And coconut oil has been getting a lot of press. It's not a good fat. It will raise your LDL, the artery clogging cholesterol. It's a saturated.
The Mediterranean diet that we know is heart healthy,
right?
Is that low in the trans fats? Is
right,
that one of the
because
reasons
you
it's so
think
healthy?
of a Mediterranean diet, so you want to focus more on eating your heart healthy monounsaturated fats, like your olive oil, your canola oil, your nuts, your avocados. And your Mediterranean diet is primarily olive oil and olive base. So yeah, it's really good. But regardless, a teaspoon of fat, whether or not it is a teaspoon of butter that is saturated or a teaspoon of olive oil that is a monounsaturated fat, it's still 50 calories. So you have to watch how much.
I love almonds, and I snack on almonds.
Well,
but you do have to be careful.
You have to be careful because 6 almonds is 50 calories. And if you notice here, this is 30 almonds or 250 calories. So I tell my patients to count out 12 almonds, put them in Ziploc bags, and that's 100 calories.
That's exactly what my wife and I do. We take a certain number of almonds.
Oh, good.
We put them in Ziploc, and because it's devastating. If you take the whole bag of almonds and sit down in front of the TV,
you have no
you'll
idea.
Never stop.
Right. When you go for those handfuls,
and the salt too,
and the handfuls. Well, and also that brings up something people entirely too much salt. So that's also part of a heart healthy diet, is to avoid the salt or the sodium, because a teaspoon of salt, which is like this, right, has 2,500 milligrams of sodium in a teaspoon of salt. So our bodies only need about 500 milligrams of sodium. So a teaspoon of salt is giving you 5 times the amount that you need. So people, they'll sit down at a restaurant, and even before they taste the food, they're doing this to their food. They're salting it. And when you go out to a restaurant, the food is good for a reason. A lot of fat and a lot of salt. So I say stay away from the salt as much as possible. Read your labels once again and ask yourself, is this a serving size that I would eat? If it's less than 300 milligrams of sodium per serving, it's a low sodium item. Greater than 600 milligrams per serving, it's a high sodium item. And you want to focus on foods that are medium to low sodium.
And just to link it for our viewers, many know, but sodium intake for many people is associated with elevating in blood pressure.
Blood pressure,
and that's
thank
the
you.
link to heart disease.
Exactly. It increases the blood volume inside of your arteries, creating pressure. And that's not a good thing. And a lot of times my patients, if you feel like your rings are really tight, that means you're having fluid retention. You need to drink more water. So it's kind of counterintuitive. If I'm retaining fluid, you're telling me I need to drink more fluid? Yes, because your urine should not be yellow. If it's this color, no. It should be pale, yellow to clear. You need to have 64 to 80 ounces of water a day. So you need to flush that sodium out of your system.
Did you have, you mentioned portion control and held up the pieces of fish and chicken that...
Yes, I like lean protein. Oh, you know what I forgot to say too? Okay, go ahead.
No, I was going to ask, do you have any tips for seasonings that are okay to use
Well,
to kind of
instead of
enhance
salt.
instead of salt?
Yeah,
Just
so using
enhance the
fresh-
bang for the buck.
Using fresh herbs and spices, garlic, parsley, basil, of course. I like things like Mrs. Dash are fine. You can buy that over the counter. Those are all wonderful. So you want to stay away from things that are packed in brine, like olives.
Like the salt, because
Salt,
of the salt.
yes. Or any canned foods. I always say fresh is best, then frozen, and never canned. And as I'm holding this piece of fish, I'm sorry, I wanted to talk about omega-3 fatty acids, which are found in your deep cold water fish, which is your salmon, your tuna, and primarily really high in sardines. So that omega-3s reduces systemic inflammation throughout our body.
And now we do want to talk a little bit about your program called
Absolutely.
Transformation.
I do want to make one quick mention, though, that some of the salt substitutes are high in potassium.
Thank you.
And if you have kidney problems, you should check with your doctor before using them.
Thank you for doing that.
Right, thank you.
Now tell us about Transformations.
So Transformations is my weight loss program at Norwalk Hospital. It runs every 8 weeks. It's $180. It's an hour class. It usually is a group of about 6 people. And it's on Tuesdays during the day and on Thursday evenings. And I have you keep a food diary. I give you books and pamphlets. I weigh you every week. It's nobody's business but yours and mine. We don't announce what the weight is. But I have a lot of success. I have somebody in my program right now who's lost 70 pounds.
Wow.
And she is my biggest billboard.
Wonderful.
So she does a lot of
And on
promotion.
that wonderful note,
Absolutely.
unfortunately, we're out of time.
Thank you.
We're not out of weight. We want to thank our guest, Barbara Schmidt, for joining us on Health Talk. Thank you, Barbara.
Thank you.
Thank you so much, and we look forward to receiving your questions and comments. Please do email us at healthtalk@wchn.org.
And thanks very much for watching.
Stay well.